And that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University.
Hello, I'm Jennifer. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Kaylee in 9/10/1992.
Okay. What brings you into the emergency department today?
I've had a fever, sore throat, and some nasal drainage for the past couple of days.
Okay. Are you allergic to any medications?
No.
Are you currently taking any medications?
No.
Do you have any significant past medical history?
No.
Do you smoke?
No.
Drink alcohol?
No.
Do any recreational drugs?
No.
Okay. It looks like your vitals here, your temperature is 102, your heart rate's 110, your respirations are 18, your blood pressure is 124/72, and your oxygen saturation is 100%. So it looks like you have a fever of 102. Have you taken anything at home for it?
No.
Okay, so we'll go ahead and give you some Tylenol, 650 milligrams per our fever protocol, okay?
Okay.
How long have you been sick?
For the past couple of days.
Okay, and how long have you had a fever?
I noticed a fever yesterday.
Okay, how high was it at home?
Up to 101.
Okay, and you said that you have had nasal drainage?
Yes.
Okay, what color is that?
It's green and it's really thick.
Okay, before I begin doing my assessment, are there any cultural considerations I need to be aware of?
No.
Okay, I see that your heart rate's elevated, so after the assessment, I'm gonna go ahead and start an IV and draw some labs while we're waiting for labs, I'm gonna go ahead and give you a normal saline 500 milliliter bolus, okay, to see if that helps your heart rate come down.
Okay. What kind of labs will you be doing?
Okay, I'm gonna do a CBC, which is a complete blood count. I'm gonna be looking at your white count to see if you're have an infection, okay? And then I'm gonna check a comprehensive metabolic panel. I'm gonna be looking at your electrolytes to see if you're dehydrated, checking your kidney function and your liver function, okay?
Okay.
I'm also gonna do a mono spot, which is a blood test checking for mononucleosis.
Okay.
And then since you have a fever, I'm gonna go ahead and check 2 blood cultures and a lactic acid. That's just a sepsis screening, okay? And then the blood cultures will tell us if you have bacteria in your blood.
Okay.
I'm gonna do a chest X-ray to rule out pneumonia. And then I'm going to swab your nose for influenza and then also do a strep screen on your throat. Okay, do you have any questions about any of that?
I don't think so.
No? Okay, so I'm just going to do my assessment here real quick.
Okay.
Okay, go ahead and take off your glasses and look straight ahead. Just looking at your pupils here. Okay, you can go put your glasses back on. Go ahead and open your mouth. Say, Okay, it looks like your tonsils are really red and swollen. They've got a lot of white exudate on them, so I'm going to go ahead and do that strep screen, okay?
Okay.
Okay, I'm gonna check your lymph nodes here. Is it tender there?
It is
Okay.
tender, yeah.
Yeah, they're slightly enlarged. Okay, I'm gonna go ahead and listen to your heart and lungs here.
Okay.
So I need some deep breaths, okay? A few more deep breaths here. Okay, normal breathing. I'm just listening to your heart right now. Okay, I'm gonna go ahead and have you lay down for me, okay? And check your belly out. Your lungs and heart sound good, okay? And listen to your bowel sounds. Have you had any nausea, vomiting, or diarrhea?
No.
No, okay. Is your belly tender at all?
No.
No. Okay. Let me see your hands here real quick. I'm just going to check a cap refill. This is going to tell me, make sure that your tissues are getting enough oxygen perfused to them. Okay, all that looks good. I'm going to check your radial pulses and make sure that they're equal. Okay, they are. Can you lift your leg up off the bed? Okay, can you lift your other leg too? Okay. Have you noticed any swelling in your legs or anything like that?
No.
Okay, let me check your pulses here. Okay, you can go ahead and sit up. So it looks like, based on my assessment, I would think that you probably have strep throat based on the way your tonsils look, but we're going to go ahead and do all those other labs and roll the other stuff out, okay?
Okay.
And then the doctor will be back here shortly to see you.
Okay.
Okay?
All right, thank you.
Thank you.